The reason why I'm not that excited is because we just lack good data that offers a head to head comparison of these two devices. So I guess we'll go to a familiar setting, my office, and we'll review the data that we do have. The first study I want to look at is this Korean retrospective study of over 140,000 patients. And this was a head-to-head comparison of the Lucas to the Autopulse, and they found that the Lucas performed significantly worse than the Autopulse. However, there is a huge caveat here. Almost 70% of the people that they evaluated were elderly, frail, fragile patients with barrel chests. And they think that that had a lot to do with why the Autopulse performed better. And they say in the study, if this study were performed outside of Korea on other races, the results would be different. However, the data set that I really want to point to is this study right here. So there was a Cochrane study performed a while back, and that Cochrane study looked at all the available quality data and came to a determination that mechanical CPR did not perform any better than manual CPR. They performed a Bayesian analysis of the study, or applied a Bayesian method to the study. A Bayesian method is when, as more data becomes available, they apply it to older data to update the conclusion. And this Bayesian analysis of this Cochrane study demonstrated that the Autopulse was associated with lower rates of neurologically intact survival as compared to manual CPR, while the Lucas was non-inferior, meaning it didn't perform any better, it didn't perform any worse. I also want to point out this paper right here. This is a safety study. It was an RCT that directly compared the Lucas to the Autopulse. And what they found was that the Autopulse was associated with higher rates of injuries to patients, and it also had a 16% failure rate where the Lucas had no failures. Something I do want to point out is that we have far more data available on the Lucas than we do the Autopulse. The Lucas is the dominant mechanical CPR device. However, Zoll has just released a newer version of the Autopulse. It has a whole lot of new features and communication with the Zoll monitor, so it can make a whole bunch of different adjustments based on that communication. Air Methods just put them on all their helicopters. Maybe in a couple of years, this data will look much different.